Well, good morning, everyone, and I appreciate everyone joining us here today. It's appropriate that this announcement is taking place in a technology hub and a healthcare hub that is all about improving innovation and embracing change. Today's announcement will be the first in a series of announcements that we will be doing aimed at bringing forward policy ideas that are going to fix a very broken healthcare system. It is centered on putting the interests of patients first, not the interests of the system, not the interests of politicians, but the interests of patients first. I hear stories every day about how our system is failing people. I want to tell you one story about a young woman named Abby, 26 years old, who had a lump on her breast, went in to seek care from her doctor in Vancouver. The suggestion was that she had an infection. They gave her antibiotics. At the end of that month, it was getting worse. She went back. She said she's concerned about it. They gave her stronger antibiotics and said, nothing to worry, just here's some stronger antibiotics. She was increasingly concerned. She wanted to get a test to make sure it wasn't cancer. They told her she would have to wait until November. Okay, this is now in January of this year, November. She flew out of British Columbia, went to Ontario to get tests. The test came back and said that she had cancer and that the cancer had spread throughout her body. It was now a case of terminal cancer. I hear stories like this every day, literally, in my office, variations of these kind of stories, and they have to stop, and we've got to make some changes. So today I'm joined by my critic for healthcare, Shirley Bond, the MLA for Prince George Valemount, and of course our candidate for Surrey Cloverdale, Dr. Claudine Stornes-Bliss, who is a doctor right across the street here at Surrey Memorial Hospital, and the MLA from Surrey South, Trevor Halford, who's joined us, and all the way up from Kamloops, Todd Stone, our House Leader, has also joined us here today. So, how are we going to change the system? There are three fundamental changes that have to take place. The first is we are going to make sure that the patient is at the center of the decision making, meaning that if a patient needs to get care and are languishing on public waiting lists, we are going to get that patient care. If it's in a private clinic, absolutely. Private delivery of a publicly funded care is going to be part of how we're going to deal with the kind of wait lists that we have today. Patients will not have to personally pay anything. It will be publicly funded, but privately delivered where it makes sense. We will also make sure that there is transparent access to data. I can tell you right now in our system, there is no data, or at least no data that is shared with the public. We want to make sure that the public understands how long the wait times are to treatment, how long the wait times are to see your specialist, how long the wait times are to get your hip or your knee replaced. All of that information needs to be made public, because when we make it public, it holds us accountable as politicians, as government, to ensure that we are improving things. And if the data shows that things are not improving, then we will change how we are doing things until we get different results. And the third plank is making sure that we have healthcare information within 2 years that will be available on every British Columbian's devices. It is important that that information be shared widely across the health system so that doctors can have easy access to your information and you can have information to your own healthcare information if that's what you choose to do. Highly secure, properly regulated, but ensuring that we make sure that patients have immediate access to that information so that their doctors are not having to work in a system where today we are still literally using fax machines to get information and requests back and forth from doctors and specialists, etc., about patients. And too often I've heard stories about the fax requisition disappearing or being lost or falling behind the machine, and that means that treatment, sometimes very critical treatment, is being ignored. And so today is the beginning of a series of announcements we will be making. But this is just the start. And it also starts with recognizing one other thing, that our system is being held together today by frontline workers, nurses, doctors, care aides, that through their own unbelievable commitment to our healthcare system are struggling to try and hold things together. And that's why it's so important that we recognize the work that they do and how important they are in our system. And that's why today I'm wearing this pin from the Nurses Union that talks about the importance of patient ratios, because nurse-patient ratios are really important for the quality of care that people receive, but also really critical to ensure that our nurses are being retained in the system and that we are able to attract new nurses into the system, knowing that they're going to be treated with respect and recognize that the work they do requires that they cannot manage too many patients all at once. So with that, I'm going to ask Shirley Bond to make a few comments, followed by Dr. Claudine Stornes-Bliss. Shirley.
Well, thank you very much. And today is really an opportunity for us to say to patients across British Columbia that we have heard you. There are almost 1 million British Columbians that do not have a family doctor. There are people waiting endlessly for treatment, for the ability to move through the medical process. And as we've said over and over again, it needs to be all hands on deck. We need to add capacity. We need to make sure that people are getting access as quickly as possible. Today is about patients, putting them at the center of the healthcare agenda. And one thing we know, we can't keep doing things the same way and hope for better outcomes. This is about adding capacity. It's about making sure that patients don't have to pay additional dollars for treatment. But we must add capacity. We need to do that quickly. And that's exactly what we're committing to today. So I also want to echo my gratitude to healthcare professionals who have shared their stories with us right across this province. When people working in the healthcare system tell us that they are facing moral trauma because they can't care for their patients the way they are called to, that's an issue that needs to be dealt with. So despite the government's efforts to paint a picture that everything's all right in healthcare, we know that the system is in crisis, it is broken, it takes bold action and innovation, and that is exactly what this first part of our healthcare plan is laying out today.
Well said. Well said.
Thank you very much, and thank you, Shirley and Kevin. I just want to start by thanking Kevin and the party for having faith in myself and Michael Humer and David Moniz as physicians to bring to the forefront what the issues are and how truly unacceptable the delivery of healthcare system is in British Columbia right now. I want to tell you a story of a man named John. One of my friends, who is an emergency physician, told me this story, and it's really, really unfortunate. This patient was seen in an emergency room in about November and was unfortunately found to have cancer, but it was resectable. That means surgery would have been curative. He was referred to a specialist, but due to lack of access to the operating room, he could not get his surgery. He returned to the emergency room by ambulance in February, where he laid in a gurney by the ambulance doors, freezing for 3 days. That's how long it took to get a CT scan. And at that point is where he had to learn, in the middle of the ambulance bay, that now his cancer was non-treatable and there wasn't much they could do for him. In Canada, in British Columbia, in 2024, that is unacceptable. And that's why we're here, to put patients before politics, before ideologies. The NDPs put their own ideologies above the quality of healthcare delivery, and that has to stop now. And that's why we're going to partner with private facilities to make sure that no matter what it takes, you get access to your care that you deserve, whether it's primary care, urgent, or emergent care. I also want to thank my colleagues who have shared hundreds of stories, whether it's crying in the hallway or celebrating victories when we have them. It's really important that we all band together, and I would like to thank everybody for being here today and helping us spread our message. Thank you.
Well said. Okay, no problem. Okay, happy to open it up to any questions. Yes.
Given that there will only be certain number of nurses and a certain number of doctors that graduate each year, and the new medical college of the government will limited to producing 30 or 60 years, and then an aging population BC of 10,000 or 20,000
Sure.
every year. I want to make that up and it's 1 million patients today without the medical health. It will be what you plan to revitalize or reorganize that whole thing and really going to build these doctors and how much space is more are you going to create for people DC kids to learn in DC and the better.
Sure. Well, we're going to start by focusing on results. That's why data is so important. You cannot manage what you cannot measure. And it is very, very critical that we focus on the outcomes, not on announcements, not on promises. The NDP have been promising a second medical facility for doctors to be trained at SFU now for years. It was supposed to actually open, I believe it was a year and a half ago, and they haven't even got started on it effectively. They've been promising a second hospital in Surrey now for 7 years, a hospital that we're still awaiting any serious work to happen. The only thing we've seen is that it's been delayed a further 2 years and the cost is doubled. So this is unacceptable in British Columbia right now. We have to hold politicians accountable for the results we get. And one of the results that you're talking about is crowded emergency rooms. Well, that is a bigger problem of a broken primary healthcare system, of a government that tried to go and build a whole bunch of urgent primary care centers that have been a complete flop. And what we have to do is recognize that the shortage of doctors didn't happen in a week. It's happened over the last 8 to 10 years. And so we won't get out of this problem overnight, but one of the ways we can start is recognizing that international medical graduates who are primarily Canadians, British Columbian young people that have trained abroad in Ireland, Australia, New Zealand, the United States, and want to come back and practice in British Columbia cannot get back because of rules and regulations that have built up over the last 75 years in BC. We're going to change that. We're going to change it by eliminating a whole bunch of those rules and red tape and bring those young people home so they can help us fix the crisis. Once you do that, and people are attached to a primary care physician, then you reduce the number of visits that are happening at Surrey Memorial Emergency Department, where a lot of people are going right now to get basic care because they can't get it in their community. And when they go to walk-in clinics, they're facing the longest walk-in clinic wait times in the entire country, right here in British Columbia. Anyone else? Oh, absolutely. Look, it's not so much taking on. You just have to understand that a lot of this is built up in over decades. And it's not just the College of Physicians and Surgeons and the doctors at BC and the UBC medical program and the provincial government regulations. It's the accumulation of all of that. And the way you solve that is you sit down with the groups around the table and you say, we're going to solve this because we're in a crisis. And when you're in a crisis, you don't incrementalize your way out of it. You make bold moves that are going to actually change the outcomes. And I actually am very confident that the doctors would work with us cooperatively to eliminate a lot of those barriers so that we can help them fix the challenges we face. But, again, anyone that comes to you with a simplistic solution for a complex problem, it's usually wrong. It requires a multifaceted approach, but it requires leadership that's focused on outcomes, and that's what we're going to do. Yes? I'm not sure I heard the critics will say which?
Critics might say that this ban will end up further subsidizing private for non-medical.
Basically,
for-profit medical.
Yes. So this will be the NDP answer. What the NDP will tell you is, oh my goodness, they want two-tier healthcare. Well, folks, I'm here to tell you that this is the same NDP government that today, as we speak, are sending patients through private clinics. They just won't admit it to you, but they are. This is the same NDP government that is sending cancer patients down south to the United States private healthcare system. Why? Because they have so disastrously managed our cancer care that we are sending patients down south for the first time since the last time the NDP were in power, just over 20 years ago. So you have to understand that we have to put that kind of nonsense ideology to the side and say, what is in the best interest of patients? And when I've got a patient languishing on wait lists that are in pain and discomfort and they need their knee replaced, we're going to make sure they get it replaced. And if it's done through a private clinic, 100% it'll be paid for by government, but we're going to make sure they get it done. Because at the end of the day, I care about the patient. And I'm not going to have patients risk sitting through months of pain, agony, and sometimes even death because the system is not meeting their needs. We're going to focus on meeting their needs.
What about the program to send cancer patients to Malaysia? Will you continue or expand that program?
Well, the tragedy is we're having to do that. So in the short term, we may have to, while we fix our cancer care system here in BC. But remember, I was a healthcare minister when the cancer care system in BC was recognized as one of the best, not just in Canada, but North America. And we've gone from the very best to the worst in the country under this NDP government. So our goal would be to stop having to send patients to the United States and get them care here at home. But in the short term, because the system has been so messed up, unfortunately, from the NDP, we can't have a system that is seeing people dying here in British Columbia because they're not getting proper radiation treatments or proper treatments, period. Anyone else?
We talked about cross-border sharing of patient records versus facts. In light of the recent drugs like cyber attacks, what's your plan to protect patient privacy?
That's always a risk, and it's an excellent question because, you know, we want to make sure that people's medical information, for those that choose to onboard, can be available on their devices so that they can share it with their physician or you know, they can look at it themselves. It'll be instant, etc. This is not new. There are countries around the world where this is just accepted. Even countries like Estonia and Israel that have phenomenal programs that allow people to have access to medical records instantly. Information is power. And we want to be able to empower those British Columbians that want to be able to have access to that information. But I also want to say that all British Columbians will have the option to opt out. If they're concerned about the risk of their health records, they will have that option to opt out. Because there is no absolute guarantee, even with banks, even in governments, as we've seen, with the level of hacking and things that take place, that does raise the risk. I acknowledge that. But we will do everything possible to make sure that we have the safest possible system to protect people's data and information. But we will also give people the option to opt out if that is of a unique concern. So for someone speaking for myself, I'm happy to, you know, have my information widely available so that my doctors can see it, whether they're in Kelowna or Vancouver or on my own device. That works for me. But it may not work for everyone, and they should have that option to opt out. Okay? Super. Thank you, everyone.